Is your body's functions at risk without you even knowing it? Do you know which hidden organ works hard day and night to keep you healthy, yet few people protect it or even know its name? What mysterious body part controls blood sugar, makes digestion possible, and keeps your energy and mood stable? Welcome back to Mindfit Fusion. It's your pancreas. Watch the video to know why you must safeguard it now before it's too late. Let's look closer at each role the pancreas plays. Digestive enzyme factory. The exocrine pancreas produces over 20 digestive enzymes and secretes them directly into your small intestine through a system of ducts. These enzymes break down carbohydrates, proteins, and fats from the foods you eat. Specific pancreatic enzymes include amylase, converts carbohydrates into simple sugars; protease, breaks down proteins into amino acids; lipase, splits dietary fats into fatty acids and glycerol. Without these enzymes, you couldn't access the nutrients in many foods you eat. Malabsorption and malnutrition would result. Blood sugar command center. The endocrine pancreas contains 1 to 2 million islets full of insulin and glucagon-producing cells. These two hormones work together to keep blood sugar levels balanced. After you eat a meal, the pancreas releases insulin. This hormone directs cells throughout your body to absorb and remove sugar from your bloodstream. It helps cells convert excess blood sugar into energy or store it as glycogen or fat. In between meals, glucagon comes on the scene. It signals the liver to break down glycogen into usable glucose and release it into circulation. This prevents blood sugar from dropping too low, hypoglycemia. What can go wrong? With such far-reaching responsibilities, it's no wonder that many serious health conditions can stem from a dysfunctional pancreas. These include acute pancreatitis, sudden pancreatic inflammation causing intense abdominal pain, nausea, dehydration, and sometimes organ failure during severe attacks. Repeated bouts of acute pancreatitis can lead to chronic pancreatitis over time if the underlying cause isn't addressed. Chronic pancreatitis, ongoing pancreatic inflammation producing dull pain, poor digestion, and endocrine or exocrine cell damage. The destroyed pancreas tissue can't be repaired. Diabetes. High blood sugar levels when insulin production is impaired, type 1 diabetes, or when the body develops insulin resistance, type 2 diabetes, preventing cells from using insulin properly. Uncontrolled diabetes is linked with nerve damage, blindness, limb amputations, kidney disease, stroke, heart attacks, and more. Pancreatic cancer. Malignant tumor in pancreatic tissues with nonspecific symptoms like jaundice, abdominal pain, and unexplained weight loss. Pancreatic cancer prognosis is extremely poor, with 1-year survival rates of 20% or less. It's currently the third leading cause of cancer deaths. Pancreatic insufficiency. Inability to digest food due to inadequate production or delivery of pancreatic enzymes into the small intestine, resulting in nutrient malabsorption, diarrhea, foul-smelling stools, bloating, weight loss, and abdominal discomfort after meals. Acute pancreatitis usually resolves within days with proper treatment. All other conditions can severely impact quality and quantity of life. That's why preventing pancreas problems should be a top health priority. Top causes of pancreas damage. What factors cause a perfectly healthy pancreas to become dysfunctional and diseased? The most common culprits include gallstones, accountable for 35 to 40% of acute pancreatitis cases. A blocked pancreatic duct prevents digestive enzyme secretion. Alcohol abuse. Heavy drinking is blamed for 30% of acute pancreatitis instances. Alcohol toxicity directly damages pancreatic tissues. High blood calcium. Calcium deposits can block pancreatic ducts and trigger pancreatitis symptoms. Inherited gene mutations. Genetic traits passed down in families boost risk for acute and chronic pancreatitis. Also for pancreatic cancer. Smoking tobacco doubles risk of pancreatic cancer and aggravates pancreatitis. Obesity. Diet high in meat and low in fruits or vegetables. Type 2 diabetes. Pancreatic tumors. Most start elsewhere like lungs, colon, or breast, then spread to pancreas. Medications, corticosteroids, diuretics, certain antibiotics, pentamidine used to treat HIV or AIDS, sulfa drugs, and more are associated with drug-induced pancreatitis. Abdominal trauma or surgery. Accidents, falls, or medical procedures near the pancreas occasionally damage this fragile organ and cause leakage of destructive pancreatic enzymes internally. This rather lengthy list makes it clear how vulnerable the pancreas is to harm. It also suggests how making healthy lifestyle choices provides the best defense against developing any diseases of the pancreas later in life. Pancreatitis prevention pointers. Since acute pancreatitis strikes suddenly and causes extreme discomfort, most people want to avoid this scenario. What steps can you take to help prevent problematic pancreatitis flare-ups? If you deal with recurrent gallstone-related pancreatitis, talk to your doctor about surgical removal of the gallbladder to eliminate the source of the problem. For other modifiable risk factors leading to pancreatitis, keep these prevention tips in mind. Maintain normal weight. Obesity stresses all organs and predisposes you to pancreatitis and diabetes. Eat right and exercise regularly. Limit alcohol intake. Avoid heavy binge drinking, which directly damages pancreatic tissues. Don't smoke tobacco. Smoking constricts blood vessels, robs cells of oxygen, harbors harmful carcinogens, and is an undisputed pancreas villain. Follow a balanced, nutritious diet. Emphasize plant foods over meat. Skip processed junk foods high in unhealthy fats or added sugars, which can inflame the pancreas. Stay active each day. Get at least 30 minutes of physical activity daily to protect against obesity and diabetes, both risk factors for pancreatitis. While acute pancreatitis often resolves after a single event, the resulting pancreatic cell damage accumulates over time. So repeated bouts set the stage for chronic pancreatitis and increased risk of pancreatic cancer down the road. This makes prevention especially prudent. Warding off pancreatic cancer. Of all diseases attacking the pancreas, pancreatic cancer earns the most fear, and for good reason. It's currently the third leading cause of cancer deaths with dismal survival statistics. The 5-year survival rate sits at only 11%. Most patients die within a year of diagnosis, as the cancer is usually quite advanced by the time symptoms appear. Pancreatic cancer doesn't respond well to traditional cancer treatments either. Radiation and chemotherapy produce little benefit for the majority of patients. Newer immunotherapy treatments offer some hope, but these primarily help extend remaining life only by months rather than years. Clearly, preventing pancreatic cancer in the first place is the strategy offering greatest impact right now. While you can't eliminate all risk, you can sharply reduce your personal chances of developing pancreatic malignancies by maintaining healthy body weight. Obesity is conclusively tied to increased pancreatic cancer. Every small reduction in weight helps decrease risk. Avoiding tobacco products. Smoking doubles risk while chewing tobacco or long-term secondhand smoke also elevates odds for pancreatic cancer. Limiting alcohol consumption. Heavier binge drinking is implicated in pancreatic inflammation and cell mutations leading to cancer. Controlling blood sugar levels. Diabetes, especially adult-onset type 2, makes pancreatic cancer up to 8 times more likely. Keep blood sugars balanced through diet, exercise, and medication if needed. Reducing exposure to environmental toxins. Carcinogens, heavy metals, solvents, DDT, dioxin, and other toxins may increase pancreatic cancer risk slightly. Whenever possible, avoid or limit contact. Scheduling regular checkups. While early detection improves odds, most pancreatic tumors rapidly spread and survival remains low. Still, getting examined annually makes sense, especially if you have risk factors like family history or diabetes. Lab tests combined with imaging can sometimes catch tumors before they metastasize, so never ignore symptoms like mid-back abdominal pain, weight loss, light-colored stools, dark urine, nausea, vomiting, or diarrhea. By monitoring your lifestyle habits and optimizing modifiable risk factors within your control, you put the odds of remaining pancreatic cancer-free more in your favor. So, after learning why you must protect your pancreas before it's too late, what specific lifestyle changes seem most realistic for you to implement first? Let me know in the comments section. And if you like this video, don't forget to like and subscribe to Mindfit Fusion for the latest health videos. Thanks for watching.